We at the Deaf Health Communication and Quality of Life Center are very excited to share the following film. This film will discuss two different research projects. One project focuses on deaf college students and their trends in searching, finding, and sharing information for health-related decision-making. The other project focuses on a nationwide sample of deaf adults and their trends in searching for information. Which source they go to first, who they share this with, and what they do with that information. We will have a lab staff member who will share results from these two studies. After that, we will have deaf community members sharing their actual experiences related to searching, sharing, and connecting health information. Where do deaf people look for health information? How many? We don't know. Have you shared, posted, asked, or searched for health information? Over 500 deaf Americans who use ASL answered questions related to searching for health information. 78% of them have searched for health information from a general source. Within this subgroup, 52% went to the internet first. Yet 50% of the people who searched for health information from a general source said that the information was hard to understand and frustrating. Are they alone? No. Family and friends should connect and provide support.
Hello, my name is Hayden, and I want to tell you my story. Last year, I found out I had stage 5 kidney failure. I posted and shared this news on social media. A deaf person reached out to me saying she had had the exact same disease. She shared how she felt, and I shared how I felt. This made me feel better, knowing I would be okay. She shared her experience, and it was nice knowing someone who had gone through the same thing. I felt relieved learning she was okay, so that meant I would be okay too. The hospital behind me provided interpreters 24/7. We sat down with the doctors and they explained everything. No information was left out. I feel healthy. I feel I am ready for a second chance at life. I'm ready for a new kidney transplant soon.
Of the deaf people who have taken our health survey, 70% used social media. In this subgroup, 50% of deaf people who used social media also shared health information. You can communicate and share information with people through FaceTime, VP, or video conferencing. Hi, my name is Melanie, and I'm a Hodgkin's lymphoma survivor. I was diagnosed 20 years ago, right after I completed my freshman year at Gallaudet University. I then received chemotherapy, 12 treatments every 2 weeks from May to November. When that was completed, I had radiation therapy every day for 5 weeks, which took about 10 minutes per visit. When I finished all the treatments and recovered, it was December 31st of 1997. When I was sick, I had to stay in the hospital for 3 weeks. There were no interpreters provided. I was young, 20 years old at that time. I did not know what to do, so I relied on my older sisters and my mother to help me interpret. Sometimes the hospital brought in an interpreter, but I didn't know how to get an interpreter. The information and resources about cancer back then were not easy to access. There was no internet. I had to read articles, magazines, newspapers, and books that my sisters brought to me and helped explain. With some research, I learned more. I also asked my family members and friends and some of my former science professors. I was nervous, scared, emotional. I was confused. Back then, when people had cancer, they usually died. Only a few survived cancer in the late 1990s. I was not sure what would happen to me. 20 years later, in present day, deaf people have access to information through computers, phones, and asking people who have survived cancer. People are willing to share, and interpreters are provided in hospitals. People have so much more access nowadays compared to 20 years ago when I had Hodgkin's lymphoma. Looking back, I'm blessed to have made it through alive. Critical health literacy is key. Deaf college students who share health information with their friends show improved critical health literacy skills. Yes, health information is not always accessible in ASL. Health videos with captions are sometimes hard to understand. What do we do about this? How do we share health information? You, your friends, and family can educate each other and help share information. Post information on social media. This will help the deaf community promote their health understanding and knowledge, which will improve their health decisions, health choices, and knowing what they need to do to take care of their health. Communication and sharing information is important.
Hello, my name is Sajran. I have a family history of diabetes and cancer. My grandfather had cancer, and he passed away, so I never met him. As I was growing up, both my aunt and my uncle got cancer and diabetes. They were both hearing, so when I asked them about it, they just said that they would be fine. Later on, my mother got diabetes too. We went to the doctor, and I did some research on the internet. I didn't realize how serious having diabetes would be. Having to follow and adjust what you eat and what you do. It made sense my mom had diabetes, because my other family members had similar issues. I was worried I would be next, so I took care of my health. I really care about my mother. It is really important to know your family history so you can prepare for yourself and for your family.
66% of deaf people have a family history of cancer. This is similar to the general hearing population. Cherish your family, your history. Don't be afraid to ask for support.
Keep the deaf community healthy and strong. Share, explain, and ask. Honestly, it may save your life.
Knowledge is healthy. Seek, share, and connect. I would like to thank the National Institute of Health, the NIH, for supporting this project. The funds helped us travel to different states and recruit participants from all over the USA. For those who participated in this project, you are important. Thank you.